अस्सलाम वालेकुम। आज मैं अपने सन इन लॉ के घर आई हुई हूँ। ही इज़ अ डॉक्टर उमर दुरानी. He's a very amazing doctor, and believe me, taking care of all of us all the time. And he gave us all good information about new corona things and everything. And I thought we can share this information, which one I think is very important to share all of my friends and all of you. So hi, Assalamu alaikum, Omar Durani.
Alaikum salam, Ammi.
Dr. Omar Durani.
Omar for you.
Omar for me, of course. My son, Omar for me. So Omar, we have to start a little bit everything. So today I'm going to say, where did you graduate from? Which university, and just a little bit your background.
Sure. I went to college at SMU, or Southern Methodist University, with a degree in biology, and then I went to medical school at St. George's University, and residency at UT Southwestern here in Dallas, with family medicine residency training.
Yes.
And so I've been practicing for 6 years now. I have a practice in Dallas called Diamond Health, and been doing primary care, general practice for 6 years now.
6 years now. Wow, mashallah. So where you practice?
My practice is in Dallas.
Okay.
It is a membership-based practice, slightly different in the sense it's a monthly or annual fee for primary urgent care. It's in Dallas proper, but my patients are all around DFW.
How much that fee is?
It roughly starts at $125 a month, and it's based on age, and it goes up to $275 a month. It's kind of like a monthly gym membership. You would pay a monthly fee or an annual fee, and for that you get your primary care, urgent care. You get your annual exams with the labs. All of that is included. We don't bill any insurance. Most of our patients have insurance or Medicare, but for us, it's just that monthly annual fee. And then 24/7, my patients can call me, text me, email me.
I know, that's amazing. That's amazing. You know, when we had to call to someone, always nurse answer us, or they want us to make appointment. And this is very good. Like you say, you can answer them on the phone or Zoom meeting and everything. It's very convenient.
Yeah, it's based off of that relationship. So I have a very limited panel of patients. I know them really well. They can call me, email me, and we have that connection where we can take care of a lot of things without them needing to come in. And then use insurance, save insurance for big issues, whether there's surgery, hospitalization, seeing a specialist. But for the one flat monthly annual fee, you have 24/7 primary care. So it's called membership medicine. So this is Diamond Physicians. It's in Dallas. And happy to be here and excited.
I know. And I will tell you one thing, because when you get residency here in Dallas, and Sabia, my sister Sabia, she called me and she said, Naila, there's a good news. Umar have residency here. So I didn't know what to do. I just pick up car and start driving. We were so happy. So you're going to be in Dallas, Texas. So this is how many kids you have, and can you talk about little about your family?
Yes, I have, first of all, a wonderful wife. I think you know of her.
Little bit.
Right? So Hannah and I have been married now, mashallah, this is going to be our 9th year. And from a standpoint, for us, we've been through hills and valleys and peaks, and we have 2 little princesses. Kenza is 6 years old, and Nura is 4.5. So they're running the show.
They're running the show.
Unlike Hannah, they still laugh at all my jokes. And they still think I can do no wrong, so I'm trying to take advantage of that. One day they'll realize.
One day they realize, that's really nice. So this is I always talk to Sabia. You know, Sabia is a very brave person who let you to go to New York, and this is a very big thing for mother, and I'm not that strong. I'm not that strong. But the other thing is, Omar, what is this new corona thing is going on? You know, we are stuck at home 1.5 years, and life is gone. We're not gathering, or schools are closed, and working from home only doctors. You guys are on first one, which one can get corona or everything, but you guys are we are so proud of you. You guys go online and do everything, especially when you have kids. You just come, and I remember Hina told me, you just go first, take shower, and before you enter your home and everything. So now, finally, we thought our life is getting better. So now what is this new virus?
Yeah, I know. It's been quite 18 months for us. This pandemic has changed all of our lives and really humbled us to realize how much we probably took things for granted, right? It's been quite a journey for everybody.
Yes.
And I know it's scary, it's intimidating, it's confusing. There's a lot of misinformation out there. There's a lot of negativity, and we can't trust news. We cannot trust social media. There's just so much, I call it junk out there. And how do we filter out what is important, what is factual, and bringing back the respect in the medical community, right? A lot of people mistrust. And so this is a really important topic, and I'm really happy you brought this topic. It's a pleasure to be here and talking about that. The coronavirus itself, this is a large family of viruses called coronavirus, and we're usually determining the common cold that we typically dealt with. A lot of them would be a type of a coronavirus, but obviously this new version is a mutated version that no human really was exposed to before, so none of us have the protective antibodies, and so this virus has obviously caused havoc throughout the world.
Yes.
And I believe the antibodies, these protective functions that our immune system has, will be made after one is infected with it.
Yes.
Or if they were to get a vaccine, they can be ready for this infection in advance. And so the point of the vaccines is really to provide that protection. So this new Delta variant is a mutation of the original virus.
Virus. Okay.
This is not anything new. This is not anything shocking that we're surprised by a mutation. Every year there's a flu vaccine. And why is that? That's because the influenza virus mutates. This is the same concept. It's just because it's COVID and it's a new virus, our bodies aren't ready for them. So the quicker we get this under control, the less mutations, and the quicker we get back to normal life.
And that vaccine, this is so many people don't have vaccine because they said this is a new vaccine, they did it in rush, and their side effects gonna be this, or someone said this. What you tell about that? But there's a new vaccine, or there's
and this is obviously something that's controversial, and there's so much misinformation on this vaccine. The technology of this vaccine, and I'm referring to the Pfizer Moderna, which is called mRNA vaccine, this is not something brand new. This is not something that we just came out within the last few months and spread it out to everybody. This is really based off of a vaccine that was made for the SARS virus, which was in the early 2000s, and the Middle East virus, MERS virus, which was also around that time. But there was no money to be made, and there was no mass pandemic, so these companies kind of had it on the shelf. But when this pandemic occurred, we already had the backbone for the vaccine there. They just needed to pick the appropriate protein on this COVID virus to make this vaccine. And now, obviously, this vaccine has provided huge relief and an avenue for us to get out of this pandemic. We're just behind on getting people vaccinated.
Yes, yeah.
And that the original goal was to have everybody mask up, get vaccinated, so in that 9 to 12 month time, this pandemic would be over with. But unfortunately,
we are praying.
We're far from that goal. So many people are unvaccinated that this mutated Delta variant is spreading throughout all the unvaccinated and even the vaccinated people, and getting more and more people sick.
And why this virus, right, this time, everyone say kids the number one?
I think, the Delta variant and the next mutation they're naming them after Greek letters. The next one would be Lambda or Mu, Omega. As it goes down, it'll be a new name. These mutated versions of the COVID virus as long as it spreads, there will be mutations. This Delta version is a lot more contagious. Not a lot more deadly, it's a lot more contagious. So the original coronavirus would infect one person. This Delta virus infects 5 people. So every time I talk, every time I open my mouth and breathe, there's tiny little droplets, particles of respiratory fluids in the nose and the mouth. Every time I talk, everyone talks, it gets spread in the air. And this is how the virus spreads. And instead of it's releasing 100 amount of the virus in this example, it's releasing 500. So a lot more virus particles spread out. And so that means a lot more people can get infected. When a lot more people get infected, then there will be a lot more people in the hospital and the people in the ICU. Majority of children do just fine. They may have cold-like symptoms, maybe like a flu, but majority do fine. But now that more kids are getting it, there will be those cases that have more severe reaction or need to go into the hospital. Just because it's spreading so fast, just the number of statistics. It's not that it's more deadly or more dangerous, it's just more people are getting it. And there will be more tragic cases because of that. So the quicker we get this under control, the quicker we can hopefully get back to normal. And this is where the vaccine comes in, and this is where masks come in. And I know it's turned very ugly and very political.
For especially kids, like you're telling me, Kenza and Nuri.
Yeah.
They're doing great job to...
It's difficult. I mean, Kenza is 6 and Nuri is 4.5, and to expect somebody at these ages to wear a mask all day is a difficult ask. For Kenza and Nura, in our family, I think they've been ingrained just being around with ourselves and what we've been through. They're very good at wearing the mask, but a typical child, as you know, it's hard to expect them to wear it. And the long-term repercussions of not going to school or not interacting and seeing the mouth and smiles and frowns, at this age is crucial for that social skills. So, but it's also important that we keep them safe and the families at home who can get the virus safe. So it is a hard situation. It's not an easy answer. And I think the answer is that we all need to quickly get vaccinated. The adults, and as much as the kids can, wear the mask, and let's let this surge kind of die down so then we can return back to normal.
And especially parents are so confused and they're scared, and that's, I don't blame them, हम लोग स्कूल में भेजें और हम ना भेजें और उनको mask, like you see, everyone, बच्चे हैं, they cannot do that. और अगर हम घर पे रखें तो बच्चों की social life, they don't have any social life. And when your education is both equal, social life है, पढ़ाई, दोनों चीज़ें equal होंगी तो बच्चा confidence और आगे आएगा. So parents ने स्कूल बच्चों को भेजना शुरू कर दिया है, लेकिन they are very scared. I heard some parents say no, we don't want it, and some say no, they are scared, पर वो still भेज रहे हैं. तो ऐसे parents के लिए आपके लिए क्या message है? What should they do?
Yeah, very important point, very important question with an answer that's not easy. It's an individual decision, a family decision that should be made. Really, again, most of the kids do just fine when they get infected with it, but they bring it home, and the children are the ones that are going to be spreading it. And so what I tell my patients, tell my family, the same thing is, if there is somebody at home who's very high risk or is unvaccinated, you really want to avoid getting that exposure to them. So sending the children to a large school is a risk that is there. And especially if they're not going to be wearing the mask or are not capable of wearing the mask. But at the same time, if everyone at home is vaccinated and healthy and low risk, then at that point, there is a benefit for a young child to go to school and have that one-on-one learning. And as of right now, it's important they wear a mask. As this surge ends and we get over, inshallah, this pandemic, we can have them remove the mask and get back to normal life. So it's an individual decision, but it's really important that you get accurate information from accurate sources. So whether it's asking your doctor or your healthcare provider these tough questions, I think it's an important one. Don't hesitate to do that.
To talk to your doctor. And like I'm very high risk, you know that, and you always text me and tell me what to do or something. But I'm just working at school and I have all around kids and I'm wearing mask. So what do you suggest me? What should I do?
Really, as you said, it's wearing the mask. The virus really only spreads from these droplets that I was talking about. So every time you speak, sneeze, cough, these droplets are spreading everywhere. And so really it's about you wearing a regular mask. It does not have to be a special mask, a regular mask. And when it's covered up, these viral particles cannot go inside. And then coming home, taking off your mask, washing it, washing your hands, you'll be fine. And just really, it's about the folks that are not wearing the masks. This is how you can easily get it. And most kids may not have any symptoms. And being around kids, and maybe they're home, they're not vaccinated, they can have it without knowing. And so it's important that the mask is on and it's on appropriately. But being vaccinated and wearing the mask, you're in good shape, inshallah. So I don't want you to worry, just be diligent in wearing the mask. And I tell other folks too, as they go out to work and maybe being exposed indoors right now, wear a mask until we get over this surge.
Okay, what is a booster shot? Because I hear people say, okay, now they told us to vaccine and now they're telling us to booster shot, and then we're gonna say, हम कितना अरसे तक ये चीजें करते रहेंगे? People are very scared. Or some say, कि when should we take that booster shot? Like 9 months, 6 months, or no time limit, like that?
Yeah, I think the first part that's important to realize is getting the vaccine does not mean you cannot get coronavirus or COVID. I think some people don't have that right information, thinking they're vaccinated, that they can't get COVID. You can get it. It's just when you get it, it's going to be mild, maybe moderate symptoms, not where someone needs to go to the hospital or ICU or all the severe cases. And so the vaccine is doing an incredible job. As of August 24th to September 1st, at Parkland and UT Southwestern hospitals, 98% of COVID hospitalizations are unvaccinated patients. 98%, meaning only 2% are vaccinated. And 99.3% of ICU admissions for COVID are unvaccinated.
Wow.
And that's not a made-up statistic. So it's really important. You can see how good of a job the vaccines have done. And so the last point of and to your question is the booster vaccine. When we as in the medical field, when the vaccines originally came out, the goal is within 9 to 12 months, we all would vaccinate and we all would wear a mask, so this pandemic would be, in essence, over. Because what we knew was 9 to 12 months is when the antibodies, which is the protective effect of the vaccine, takes a big dip. And so unfortunately, so many people are unvaccinated and the Delta has mutated. There's a big surge in infections. And now 9 to 12 months, which is around this time, there's a big dip in protection. So now we need a booster because we did not do a great job in the beginning of getting everyone vaccinated. And this booster is a very common thing. Most childhood vaccines, most routine vaccines that as a US citizen or as a young child going to school in Texas, you have to have are 3 to 4 shots. And each shot after the first one is called a booster. So this booster is not new. We know that the body needs these reminders to keep on making the antibodies. Eventually, it will make it lifelong. So the booster is really important for those very high risk that are going to have this dip in antibodies. And with the Delta being out there, it's important we do a booster. And then hopefully, inshallah, this time next year, we are over this surge and we don't need another booster. But if not, then it may be something like the flu vaccine every year. And I know people hesitate with that concept. So we all have to work together. Right now, people are not together. They're very divided. And it's important that we all work together to end this pandemic.
And that's not thinking a doctor only can do that. We, all of us, we have to listening ear. We have to wear mask and we have to take vaccine to get out of this situation. This is really everywhere. So how about Umar, anything which one I miss it and you think is very important and you want to talk about this virus?
I would say the main thing you brought up, a very important point, is wear the mask. I know it's tiring. We're all tired and exhausted of this pandemic and the toll it's taking in so many different ways. But it's really important as of right now, during these surges, to wear a mask indoors. And if you have not gotten vaccinated, really get some expert medical opinion, especially talking to your doctor, and figure out why you're hesitant on the vaccine. And I tell my patients, weigh the risk of, what is the risk of me getting COVID and what happens with COVID, and what is the risk of me taking the vaccine? And really calculate that out and make that decision. But don't make your decision off of a WhatsApp message or news feed. Rumor, exactly.
Rumor is really, that's... and we all do that, that's why I decided to talk to you about this topic. And you have such a busy schedule. I can see you guys are you and your wife, both of them, you are in hospital and you come and give really quality time to your kids. And there's any your hobby and which one besides work, you can do that?
My hobby is making henna and the little girls laugh.
Yeah.
Sometimes I'll succeed, sometimes I don't. It's been difficult because we really like to go out and see our friends.
Yes.
Maybe try new restaurants and socialize. And it's been a challenge, but it's worth being on the safer end of this decision over this pandemic. Yeah. And hopefully, inshallah, soon we can travel freely and go back to our
I'm gonna look forward to have our family
family vacations.
Family vacation with all of you guys, and this is really a difficult time for everyone. This is really difficult. I have one more question. Like some people sick, and some people they say they have fever and they came to work without testing. So how important is testing is, and when they should go for test?
Very good question. I'm really pleased because this is a very important point. Testing for COVID or coronavirus is not a perfect science. These tests have to be done at the right time. And that means the medical professional, the provider, can help guide when to test. The situation is, depending on when your symptoms started, or when there was a known exposure, meaning you find out somebody who's a family or friend is positive, the timing is really, really important. Doing it too soon does not mean it's negative if it was negative, or doing it too late can also delay treatment time. So it's a confusing kind of situation. So really the importance is, number one, is trying to find out when you were exposed or when the symptoms started. And based off of that, usually within 48 hours of symptoms starting, you should go get a test.
Okay.
And the test can be either an antigen test, which is checking for a protein of the virus, or a PCR test. And these are different types of tests, and they're readily available at routine local pharmacies, your doctor's office, COVID testing sites. But timing is crucial. So 48 hours is usually the best time. You don't want to do it too soon.
Okay. But that's a good thing, because if someone feel little down and they go to next day and have test and it comes negative and they just come to work, and that's why they need, like you say, how much time they needed.
Right, and then the importance is wearing a mask because you may not know. This is the subtle thing here is this is why this pandemic has become so difficult is 2 to 14 days you may not have any symptoms, but you're spreading the virus and you don't know. The person is not aware that they're spreading the virus. 2 to 14 days. That's a long time. That is why masks are important.
Okay. Let's see when they went and they become positive. So what should they do? Or their family members become positive and they are staying with them. So what should they do?
Very good and important point. So the first thing is the person who is positive needs to isolate. So they need to, number one, wear a mask and isolate whether in their room or within the home. And number two is try to find out who they were around and let them know. So obviously if it's in the family, everyone in the family can stay amongst each other but not leave, but they should see who they were around and call the other friends or family member to let them know, hey, I'm positive, go get tested. That's an important thing. Second is call your doctor. If you are positive and you have whether symptoms or not, touch base with your doctor to figure out what you want to do or what are the next steps. Because everyone may have some individual issues going on. They're on different medicines, and so the treatment plan may be a little different for everybody. In general, though, it's going to be making sure you are well hydrated, you are taking some of your basic vitamins, and really resting. The appropriate time to return, because most people do fine. They are
like we are so afraid before.
Right.
Okay, we just heard dying, and this is
I mean, it is one of those things where this virus, for some people who are high risk, can really turn into a severe disease and severe issues. Majority of people who are absolutely vaccinated can and will do just fine. It's just you want to wait the appropriate amount of time before you can get out of quarantine. So it is 7 days from your positive test with a negative test as proof, or 10 days total. So you have two choices. One is 7 days with a negative antigen test, or 10 days of isolation, and then you can return to work. That most of the individuals will not be infected at that time. The only other point is if someone is positive and they're having worse symptoms, they're not doing too well, they have trouble breathing. Now I tell my patients to buy a pulse ox machine, which is a very easy, cheap technology you can purchase. You put it on your finger and get oxygen levels. That's a really important tool to have at home, and you can purchase it at your local CVS, Walgreens, or Amazon.
What's that? I'm sorry.
It's called a pulse oximeter, and it's something that at the doctor's office they'll put on your finger, and it can tell you what your oxygen levels are. And so I actually, for you guys and here at home, I have them. Anyone can purchase it. It's $20 to $30. It's kind of like having a blood pressure machine at home. It's an important information to have to know when you need to get higher care. So checking your oxygen levels, and this is actually an example of a pulse oximeter. You can see that. Very simple technology. You just turn it on, put it on your finger, and within seconds it'll tell you your oxygen level.
What's your oxygen level is?
Hopefully good. No,
but how you check? Like me, I don't know.
Right. All you have to do, see, it says 99%. That's 99% oxygen level, and normal is 97% and higher. You can tell how quickly it works. Just give me your finger.
Let's see, check mine.
And you see within seconds, a number will pop up. And this will tell us your oxygen levels. So whenever you see levels,
98.
Yes, good job. A plus.
A plus.
But when you start seeing oxygen levels go down below 95%, and you...
Below 95%.
Yes, and you have coughing, shortness of breath, you are COVID positive, or you're exposed to COVID, but you're having worse symptoms, you need to call your doctor. If you don't have a doctor, you need to get medical attention, because that's where the progression of the disease can occur. Now we have therapies for it. This is called monoclonal antibodies. These are very specialized infusion and therapies that have changed the game in regards to treating COVID and catching patients before they have to go to the hospital. But it's about access to your doctor or medical provider.
But I actually don't understand about this one. What is therapy?
So before, we did not have medicine for COVID.
Right.
We would just wait and see, and then people would have to go
because
to the
that's a new thing for us.
Correct. But now, within the last year and a half, we've created medicines called monoclonal antibodies. And it's something that you cannot just go purchase from the store. This is very specialized medicine that are at local emergency rooms, local infusion centers. And the patient that has less than 95% and is not doing well, or their symptoms are getting worse and worse and worse, they need to get that infusion. And they can. Here in DFW area, we're blessed to have this ability. And if you catch it and you get this infusion within a week time, this will, for the most part, prevent hospitalizations. Patients can turn around 8 to 12 hours later. It's pretty amazing. And so access to this and deciding when can this happen, this is going to be based on your access to your doctor. And so this is where unfortunately, a lot of patients don't have that access. And I take pride in making sure people are aware of these options so they know when they can at least ask for it. So there are therapies out there.
I didn't know that.
And that's why we're seeing people make it. People are doing fine. It's just we need to get over this surge. And if we have symptoms, know when to stay in. And if things are progressing, know when to seek help. Absolutely.
Yeah. And there's many people, they say, we don't have insurance. We don't want to do this headache. And some people cannot have insurance. Insurance is very, very expensive. So what they do? They come to Dr. Durani.
I take pride in a diamond and my clinic that I have. For us, it doesn't matter if you have insurance or not. It's a monthly or annual fee, and we provide primary and urgent care for that. Most of my patients have insurance or Medicare, and ideally, yes, you need insurance Medicare for major issues. But for primary and basic urgent care, we can take care of that for that one fee. But in regards to COVID and the pandemic, one of the things about the CARES Act and some of the laws passed is you have access to free tests. You have access to getting treatment, insurance or not. But it's about seeking it at the appropriate time. There are free testing sites available. Some of the local masajids, Carrollton Masjid, Frisco Masjid, and throughout the Metroplex, there are free testing sites that are there, whether you have insurance or not. And so the community is set up for this. And then going to the emergency room for more severe cases, I know it's scary, but when someone is decompensating clinically, you will get treatment. There is no bill when it comes to this. And I will say that's one of the things that, Congress and the Senate have passed this CARES Act. There is access that is there that never was there before.
Oh, okay. Yeah, there's so many ways. And anything else, which one I didn't ask you about this virus, because the other day I went to some lunch and we all ladies talking about, and one lady's telling me her nephew is in Dubai, and he took booster shots and he becomes so sick. Why is that?
So this is part of the situation where there's a lot of misinformation, and there may be some tragic cases in regards to a reaction that could have been from the virus, but there's a lot of missing information there. We don't know some of the situations of this person's health and when the vaccine and what happened. So these one-off stories cannot determine the benefit for millions and billions of people. There's a reason 99.3% of ICU admissions for COVID are unvaccinated. And the people that are nearest and dearest to me, I've made sure they're vaccinated and really push the vaccine, not because of some agenda, but the people that are most precious to me, I've made sure are vaccinated. And for a reason, because we have to start believing in science and believing in the fellow man, humanity. We've really become very negative and skeptical, it's important you do your education, you do your research, but it's also important you get your information accurately.
Yes.
Unfortunately, there may be a case like this, but I read as in the United States, almost 100 million people have been vaccinated, and the majority, vast majority, are just fine. And when I say vast majority, I'm talking 99.9%. So,
yeah.
and this could be a blessing from Allah, as you say.
Yeah.
These are things that we have to keep in mind. I think we took our lives for granted before, and inshallah we'll get it back. But I think the key is going to be us working together.
And this booster shot, some people, like you say, rumor is a lot, and we sometimes believe in that. Some say it's 8 months, some say 9 months, or some say it's okay to take any time. So what do you say?
So what we know is the antibodies, the protection, dip at 9 to 12 months. And so what the recommendation is 8 months after your second shot to get the booster. And right now it's not readily available. It's only for the very high risk.
Okay.
And then it will be open to high risk, which is age 65 and above. And then it'll open to the general public. But 8 months after the second shot. And the reason 8 months is we're trying to catch people to boost the antibodies before that 9 to 12 month mark.
Okay.
And so that's why we're saying that. And getting it slightly earlier, there's no problem with it. There's no issues with it, but we're trying to get individuals before the dip in antibodies.
Okay.
Again, this is something that's expected and known. This is not shocking that there's a booster that's needed, but that's why the 8 month mark is there. And as of probably October is when it's going to open up for most people.
One more time, thank you so much for giving me time.
Anytime.
I love you guys.
Thank you for having me.
And I know you're busy. This is your relaxed time.
No,
But I
this
just,
is
I just came and thank you a lot. Thank you so much. And I hope you guys have better information, and you guys, some people have question and they don't have answer. They can get their answer for now. So I gonna be saying bye. Khuda Hafiz, inshallah, until next time. Okay guys, bye.